The broadcast is now starting. All attendees are in listen-only mode.
Good morning, everyone. Welcome to the webinar this morning. I'm Dawn Miller with the Division of Behavioral Health and Recovery, and the webinar this morning is going to be presented by Mindy Greenwood from Cascade Mental Health. She's going to talk about incorporation of SE and SUD services, and I've been talking with her for a little bit, and I'm looking forward to hearing what she has to say. Lots of knowledge. This webinar is being recorded. You'll notice that Mindy is showing her webcam, but I would ask that no one else turn on their webcam. It does end up decreasing our bandwidth and makes it harder for the system to record. So please do leave your camera off. There isn't a PowerPoint this morning, and Mindy's going to speak from her knowledge of her scenario, and would love it if people would ask questions if we go along. In order to do that, you can either click on the hand sign. If you look at where it says attendees, and you click on the right-facing triangle so that it faces down and you can see all the attendees, there's a little box where you can check to raise your hand if you want to do that. One of the ways of doing that. So please ask questions at any time. Either raise your hand or type into the chat box. I'm going to be monitoring both of those. Thank you for attending today. I will send the recording out at a later date along with a thank you related to attending. So Mindy, with that, I'm going to turn it over to you.
Okay, thank you. Thanks everyone for attending. So just kind of wanted to start out by giving a brief history of how Cascade got involved in supported employment. Probably early to middle of 2017, our clinical director started talking with Lisa Bennett Perry about that this was coming down the road, and he got really excited about it. So he asked me how I felt about it, and I felt that this would be a great addition to substance use clients. And I really do come at it from a substance use view. That's the agency part that I work in. So we were really excited about that. We started gearing up, going to as many different classes that Lisa was putting on, seminars, those kind of things. And so finally, January of 2018, we signed our contract and we started doing supported employment services. Then came time to try to figure out where were we going to station those clients or the staff to meet with the clients. Historically, everything went into the mental health side, and I really pushed to have them stationed in my substance use department. Considering that they made me the program director of it, I was like, I want them over here because I really wanted to integrate substance use into supported employment. I do believe that it really helps with their recovery. So we wound up stationing them here, and in doing that, I made the supported employment part of the substance use team. They come to all the team meetings that I have with my substance use department. They can walk up and down the halls and talk to them. They see the clients when they come in and out, and it works great. They do still go over to the mental health side, and they do go to all those team meetings, and they interact with those counselors too. But I think being here on the substance use side really helped the clients understand that they can go out and they can get a job with the support that we're giving them. A lot of them were concerned, as you know, about positive UAs, those kind of things when it came to employment. But by having the substance use team and the supported employment team helping support them through the process, we really haven't had that much of an issue with that. So once we figured out where we were going to station the staff, they let me start hiring staff. So I got my first staff in March. She was a godsend to come on. She really helped us stand up the program, helped me with all the policies and procedures and getting it going. She has given me some of her statistics that she's had since the induction of the program. She's actually had 133 referrals, and 44 of those have come from the substance use department. So she's doing a good job trying to get those coming in. And then she's had 17 of those 42 actually really engage into services, all the way into where she could start looking for jobs for them, and eventually getting them jobs. So 12 of the 17 have found employment. So she has a good turnaround. She's got a 71% turnaround of people getting employment. And she's really good about going out into the community, talking about how supported employment helps them, and helping the clients, helping the employers be able to hire the clients. She also is really good with helping me go out and talk to our own staff, getting the buy-off on the staff. I know my Ssdi staff in the beginning, they didn't want to make referrals to the program if they were an intensive outpatient, which is where the clients are coming 3 to 4 times a week, because they just didn't feel like the clients were at a place that they could engage in multiple services. And that's kind of been what it was historically. Even when we would get referrals from Dshs through the Worksource program or something like that, if they were in intensive outpatient with Ssdi, Worksource would even cut back their hours searching for employment, because we used to believe that at this level of care, clients can't have this much on their plate to do. We're finding that's not true, that yes, they can. They do need a little extra support, but they can do the extra work to get this done. So we've gone out, we've talked to our community. We are a rural community, so we don't have as many resources as one of the urban or metro areas, but we are getting a lot of buy-off from the community and getting stuff going there. The staff, we do still have some issues with staff. Most of the staff has bought off on it, but there's still a lot of staff that don't feel that they can make the referral. They don't feel that their clients can do the work that they need to do to be able to get a job. But we continue with the zero exclusion. We continue saying that it's the client's choice. If the client is interested in employment, let's get them started. There's nothing wrong with getting them started to start working with the supported employment staff. And if, you know, in the end it doesn't work, that's okay. They started it. They know what it looks like. They know some of the steps that they would be required to do. They understand the support that the supported employment people do, and we've had people come back into the program after they've been gone for a while, and they have been successful. So as I was talking about before, integrating it into Ssdi, I felt it was very important to have a supported employment person in the Ssdi department. I needed to have that person here talking with the substance use staff, talking with the clients as they're walking in. Clients tend to be a little leery of new people working with them. So by them being able to see them on a daily basis, they started asking for questions for the program. I also had the supported employment staff go into group settings. And in the group settings, they talked about the program. They answered questions that the clients had. They made sure that the clients felt comfortable with them. And every time I have them do that, I have them do it about every other month, go into all the groups. Every time they do that, they walk out with a ton of referrals. And we start down the process again with those new referrals. And then by mouth, the substance use clients, they talk a lot with each other. So they're going to be your biggest referral source, is just those clients themselves. The successes and trials of having Ssdi clients in supported employment, we've had a lot of successes. To be honest, the biggest trial that we've had is we've had quite a few who want to work in the marijuana business. They wanted to go work at some of the distribution sites. We had some questions around that, considering that this is federal dollars, and on a federal level, marijuana is still not legal. It's legal here in Washington State. So at this point, the direction that we have is we're not necessarily helping them get employment at any of these kinds of services. However, we are still helping them with their resumes. We're helping them we do mock interviews so that they can get some interviewing skills. We do everything outside of actually going to the employer when they are asking for these kinds of employment places. Obviously, we do work with the substance use people, and we try to help them understand if this is necessarily the right place for them to work, but it is the client's choice, so we just keep working through that. Those, I think, are the biggest trials that we have. Outside of us being in a rural area, we don't have a lot of transportation. We don't have, we're very spread out. We're a very long and narrow county. So once we hit the east end, which out in Randall, Packwood, Morton, that becomes a little more difficult, but we actually have had some successes out there with people being able to get jobs. So that's been great. That's been a lot of help. There's a lot of seasonal work that happens here, which is not necessarily what we want for supported employment when you're talking about IPS, but that is what we have to work with. So we just kind of go with it. And some of the clients are even saying they only want to do seasonal work. So we help them do that. But other than that, we don't have a ton. I do work better off of questions around these kinds of presentations. So if anybody has questions, I do really invite you to ask them. So I'll just wait a second to see if anybody has a question.
I don't see any as, oh, I see one hand raised. Hang on just a second. Let me figure out who that is.
Okay.
All right, it looks like Lisa. And I'm going to say Stridinger. Lisa, I went ahead and unmuted you from my end. It looks like you're also muted from your end. So if you would like to unmute, you can ask the question verbally or you can type it into the chat box, whatever works best for you. Looks like you're still self-muted. All right, so Lisa, if you still have a question and want to type it into the chat box, that's certainly an option available to you.
So as she's writing that up, you know, another thing that I've been thinking about with the supported employment staff working with the Ssdi staff, a lot of the supported employment staff, you know, this is new to them, working with them, with people who suffer from mental illness and substance use disorders. So some of the behaviors that are associated with that, they work with the staff, the mental health staff and the substance use staff, to get help working with the clients. And it's become very, very helpful to everybody all around, because you're not, for the supported employment staff, we're not necessarily hiring a CDP into that or a mental health professional. They're more peer to help clients work through the process. And you just really need to have the two different staffs working together so that they can do the best care for the client.
So, Mindy, I've got a couple of questions for you now. Pardon me. One of them's Thomas Anderson. Pardon me. Who asked, how many staff do you have on your SE team, and how long did it take you to work up to that size?
So I just hired my third person, which, to be completely honest, I should have hired the third person a couple of months ago. We actually ramped up fairly quickly. We were only doing internal referrals. I hired my first staff in March. By April, I had to hire my second staff. And we just opened up to external referrals the beginning of this year. So it really, within a year, we were right there on there. Those guys were carrying the caseloads and doing what they needed to do. It really did not take long at all.
Wonderful. I have several other questions now, and I will get to everybody. Lisa's question was, do the clients need to be enrolled in your service to get supported employment? Can they walk in, or do they need to actually be enrolled in the services?
Yeah, like I said, as of January, we started taking external referrals outside of just Cascade. We made the decision in the beginning to only do Cascade so that we could get the program up and running and knowing what we were doing, getting my staff the IPS training, those kind of things. But as of now, as of January, we'll take external. So Lisa, if you have anybody in our area, they just need to call the Chehalis office, tell them that they want supported employment. We get them scheduled with the supported employment staff probably within a couple of days at the most to get that going, to get authorization, and then we just start rolling. And so if we do get the referrals from the other agencies, we do make sure that we are working with those other agencies hand in hand, just like what we're doing within our own agency, all the different departments. So you would expect, if you make a referral to us, to be contacted by the supported employment staff and working very closely with them.
Next question is from Janine Miller. Is it helpful for people to start part-time, then roll them into full-time?
You know, I would not say that it's helpful or unhelpful. What I would say is that we're working with the clients as to what they want. We do a whole assessment on them. We find out from them what they're looking for. And like I said, there are some clients that want part-time, that want seasonal. There are some clients that just want to get a job right now and work towards what they want as their career, and we'll continue to work with them on that. So it's a wide range of things that we work on with the clients.
All right, and then Julia Osborne asks, how do you work around clients' busy schedules with their IOP, counseling, court, et cetera? How do you work trying to find them successful employment around this?
So we sit down and work with the clients, and a lot of times the court stuff, they're meeting them probably at the most once a week, a lot of times once a month if they're district court I don't even know that they're doing it once a month if they're district court. The intensive outpatient, our particular program, they come 4 days a week, but we look at what their schedule is and we look for a job that goes outside that. But if we find, let's say they're coming to our day groups and we find them a job that's during the day, we'll move them to the night groups. So by supported employment and the substance use team working that close together, we always know what's going on and where we need to be able to help adjust the clients if need be. The other thing with that too is when we have clients in services, and let's say we have to up their level of care, maybe send them to inpatient because they are struggling, then we can also work with the supported employment team on that. It doesn't mean that the supported employment team stops doing any job searching or research or finding out some education for them. It just means that we may have to just collect all that data while they're gone to inpatient, and when they come back, they get right back into the supported employment team and doing everything. And I'll be honest, I was a little concerned that was going to be overwhelming to the clients, but what I'm finding is they're coming back, they're excited, they want to hit the ground running. When they come to the window to get scheduled back in with us, they're also saying we need to get scheduled back in with their supported employment person. So it's working out really well.
Nice. And then Thomas Anderson asks, what size are your staff's caseloads?
So Dawn, don't listen to this. So we do, to make our program viable, I do have them carry a little bit of a bigger caseload, but basically how I'm justifying that in my mind is if we have somebody who's in post-employment, basically we're doing 4 to 1. So 4 people in post-employment would be 1 person in pre-employment. because a lot of time when they hit post-employment, they do not want as much support. If it is somebody who needs just as much support as a pre-employment, then obviously I would count that differently. But right now, most of our post-employment people, they're wanting contact once a week, just at least even a minimum of a phone call just to check to see how they're doing. So they're carrying about a 25 to 30 person caseload, but that does not include people who have gone inactive. So if you looked at the caseload of people who have just kind of disappeared, and as you know, AmeriGroup wants us just to keep them open until their authorization runs out, they probably are sitting around a 40, 45 person caseload.
Lisa said thank you, by the way. Next question is from Olivia. What have you found is the most significant difference in providing services to clients with substance use co-occurring disorders versus strictly mental health disorders?
Honestly, our substance use clients are more engaged, actually. They tend to show up more. They actually really want it. They don't see their substance. They see their substance use as a barrier to a certain extent, but they don't see it as much of a barrier as a lot of our mental health clients do. And I don't know if that's, while substance use is a chronic disease, we've always treated acutely. Mental health is also a chronic disease, but they treat it chronically. So I don't know if that's just a mindset that clients have believed that it's going to take them longer to go into a recovery process than it would a substance use client. I really don't know what it is, but I do know that our substance use clients tend to engage quicker, longer, and they are more active in it.
All right, and the next question, and I'm going to apologize for mispronouncing your name in advance. Rhea is asking, what is your referral process? Do you have a separate referral form or phone number besides the Foundational Community Services, Foundational Community Supports referral form?
No, so internally, we just have them fill out that form and then they send it to my front desk people here in the Chehalis building, and then we just call them. So we get the referral and we've made a phone call to them within 24 hours to schedule them with their supported employment. For external referrals, they're just calling the office here in Chehalis and we're just getting them in. I've really tried to keep it so it's not this big process to try to get in that you have to do, this first appointment and then another appointment and all this stuff. It's basically you just call and we'll screen you out in that first appointment and let you know what's going on, if you can get in or if you can't get in.
Okay, I'm looking to see if there are other questions. We appear to be caught up right at the moment. I'm also going to check the chat box, and I don't see anything there. So we are, pardon me, we are caught up on questions right at the moment. Do please, you guys are doing a great job. If you have questions to ask, raise your hand and I can unmute you or type into the chat box, either one. So Mindy, what qualifications are you looking for in a staff when you hire staff? What kinds of things do you hope to see?
So for the staff that I've hired, I've had a couple staff that have left, and to be honest, I was looking at first for staff that had employment experience. Now what I've been doing, and I've had better luck with that staff, is I'm looking for staff who are engaging, who really know how to use the computer skills. I really need somebody who has computer skills. Mm-hmm. But basically who are engaging, who are willing to think outside of the box to help people achieve employment and be creative, because like I said, with us being in a rural area and not having access to as many resources, we have to be creative. Now, we aren't necessarily doing job carving, but we're doing some job carving to help with with those clients. And, you know, I have staff who are comfortable being out in the community. That's a big thing. We don't necessarily have where we're going to people's homes, those kind of things. What we're finding though here is clients like coming in here. They like coming in dressed up, like if it was a job thing, and kind of getting that feedback from the staff saying, hey, you look great today. This is a great outfit to wear for employment, those kind of things. So it seems to be working that way, but the staff has to be engaging. They have to be able to just start up conversations with essentially strangers. They don't know who these clients are. They do have to ask some hard questions to be able to support them in their employment. Because if we don't know everything that's going on with them, then we're not going to be able to support them in the correct way.
Absolutely. We've got some other questions. Lisa asks, are you going to get involved in supportive housing?
So at this point, we are talking about it. And it is something that I do believe is highly needed, especially in our community. And hello, Lisa. I agree with you. It is a huge thing. But we haven't pulled the trigger to add that to our contract at this time.
Okay. Erin asked, do you support clients who want to go back to school?
Oh, absolutely. So I don't know, when they're doing the vocational assessment and everything, we're asking them what is their career goal, not just what is their job goal, what is their career goal. And if their career goal is something that they need some education for, then absolutely. We've taken many clients over to the college to sign up for financial aid, sign up for schooling, those kind of things, especially our younger clients. We do take adolescents that are coming out of high school and just need some help. One of the things I've been very lucky with is Whitney, who was our first employee in there. She comes from the military background. So a lot of the younger clients are interested in joining the military. So she's able to counsel them and give them lots of information on all the different branches of it. So that's been a big asset for us, for her to be able to help walk them through what it would look like if they apply for military services also.
Let's see here. Janine asks, where do you get your forms, referral, intake, brochures?
So like forms that we're handing out, or the forms that we're using to do our assessments and those kind of things?
Janine, do you want me to, oh, she says yes, both.
Okay, so the forms that we use to do all of our assessments on our work, those really came from AmeriGroup, who holds the contract. So we did build them into our electronic health record, but they match exactly what AmeriGroup wants. They have specific things that they want us to be assessing. Then as far as any marketing tools or brochures or flyers that we do, we actually put them together. We have a 3x5 card that we use. It's actually kind of nice, that we send out to, I send them out with the staff. They have them on them all the time. So wherever they're at, they can hand out the 3x5 cards. We've made up flyers that we put up all over the place that just talks about the program and how to get in. We're branching out to put them up in more places that you wouldn't necessarily think about. We initially just started putting them up and handing them out to like Worksource, Dshs, Dvr, those kind of things when we first were building the program, trying to get those relationships off the ground. But I want to be hitting churches and all kinds of other places for clients to be able to get the information.
Wonderful ideas. Lisa wanted you to know that she doesn't have a lot of computer skills, but is a certified peer counselor and recovery coach with extensive skills and knowledge and looking for work if you need help. Good job of networking, Lisa.
Go ahead and send me your resume, Lisa.
Janine came back with from the book and Fidelity. Janine, one of the places that you can look for forms and things is on the ipsworks.org website, and the link up above says library, and they have a document library and just a lot of different forms in there that obviously you can pull from and use, or use as a template to create your own or whatever you might want to do. So I would highly recommend looking at the ipsworks.org website too. You're welcome.
Yes, that's a good point. And I highly suggest any staff to make sure that your staff takes the IPS training through Dartmouth. I think it's only like an 8-week course. It's all webinar. It's only like $250, but let me tell you, it really gives your staff the tools that they need to do this new way of thinking. The other thing that I added to my staff is I'm putting them through motivational interviewing training. So that just really helps them incorporate the IPS model even more, because it really is a motivational interviewing model of meeting the clients where they're at and moving that way. We've had some clients who they kept telling us week after week after week that they wanted to get a job. We met with them over and over and over for those first 6 months that we got the authorization, but in the end, they didn't pull the trigger, so to say. What it really came down to was they liked the social interaction that was happening. And that happens, you're going to have that happen, but I just kind of go with the thought of, well, they were in the program for 6 months. They know what we're pushing and what we're asking for them to do. And if they decide that they do want a job, then they'll come back. So that was one of the other ones that we had a really struggle one. We had a gentleman who had some dementia stuff going on, and he kept saying that he wanted a job, so we kept trying to work on that. That was a difficult case. I have to hand it out to Whitney, who was given that case. She kept trudging through that and doing what she could to move that along. So, like I said, with the motivational interviewing and the IPS training, that really helps your staff. If you have not gotten your staff to those trainings, I really suggest that you do.
Good suggestions. Olivia asked, do your staff typically disclose working for Cascade and that the client is receiving SUD mental health treatment when conducting job development?
No, they don't. They don't actually have to divulge that. I think maybe out of all the clients that we've done, we've divulged it once or twice, but the clients are divulging it themselves. We do say that we work for Cascade and that there's supported employment, and that they're here to help the clients with their employment and also to help the employers. I think that's the piece that a lot of the supported employment programs forget, that we're not here just for the clients, but we're also here for the employers, because if we can help the employer is going to kind of be your secondary support to help that client be successful. Mm-hmm. So that's really how we kind of introduce ourselves. If we do need to go further, we will. We have the client sign a release and we go further in depth of what's going on. But we really haven't had to. The clients have pretty much done it themselves. We talk to the clients about disclosing what's going on with them. And I think that that's the key there, is it helps the clients be able to advocate for themselves, because in the end, we're not going to be around. We want to really give them the skills to be able to advocate for themselves and what they need in the workplace, just like we advocate for ourselves and what we need in the workplace.
Let's see. And then Olivia also asked, will you please repeat what the training is you were talking about prior to discussing the motivational interviewing training?
Oh, the IPS training. The IPS is the model that Supported Employment has decided was their best practice. It's the individual placement services. Yes. Individual
placement and support.
Placement and support. So it's on if you just Google IPS, I do apologize, I don't remember that website off the top of my head. But if you Google IPS, you'll find that website, and Dartmouth provides the training.
Right. So Mindy, it's the ipsworks.org is the website, and there's a
Okay,
tab at the top where you're going to find the tab library. If you look over a ways, there's also one that says training. They have an online training. They have various face-to-face training, but in order to attend that, you've got to go to New Hampshire. Great training.
Yeah.
It's a bit of a trek. Lebanon, New Hampshire.
Yeah.
One of the other places, and I'll mention to find some instructional information and forms and things, is our very own Pathways to Employment website. It's a Washington State developed and run website. So if you look up Pathways to Employment, that's something that's also instructional. I apologize. I'm in a hotel and I hear a vacuum in the hall. I hope that's not disruptive. Let's see. Janine says, great class from Ann Ryder, Holding the Hope, Motivational Interviewing. Thanks for sharing that, Janine. And Stephanie says, how have you engaged with potential employers to reduce stigma for people in SUD treatment? Is this a challenge?
Yes, that's always going to be a challenge. I think that's just the nature of the SUD. However, I will tell you that that has changed a lot in the last 20 years. Again, I guess I'll be perfectly honest with you. This was really hard for me because being an SUD provider, I know what the stigma is out there. I know that clients struggle at times, and that's the nature of substance use and going into recovery, and it's not anything bad. It's just the struggle that they go through as they move towards their recovery. So being part of the Supported Employment program, being the director of it, sending my staff out saying, you know, you're kind of vouching for those clients, knowing that there's going to be potential issues around that. It was really difficult for me, I'm not going to lie, but I found that we're not having to disclose it. Clients have been disclosing it. They've been disclosing it to employers that they've had an issue, that they are in treatment, have been through treatment, whatever. And we haven't had that much of a problem with it, which I've been very pleasantly surprised because I live in a county that carries a lot of stigma around substance use.
I don't see other questions right at this moment. Do please, if you guys are doing a great job of asking questions and great questions, do please either raise your hand or type into the chat box if you have something that you want to say, or I can unmute you and you can speak, is the other alternative. So just, you know, let us know if you have a question to ask. And I don't, out there I see one from Erin. Are there other trainings you would recommend?
I highly recommend that you go to any of the trainings that Dawn and Lisa Bennett-Perry are putting on. Those have been very invaluable to us. I'm actually heading to the cash and benefits training next week. Whitney and Marie both have had that. That is something, since Whitney had it a month ago, that we've integrated into the process, and that has been a huge success. But any of the stuff that Dawn and Lisa are putting on, I suggest you guys get there. They are free. I know in some cases you do have to pay for maybe some travel and hotel, but as we're growing this program in Washington State, this is invaluable because you get to meet with the other people who are doing supported employment. You get to network, you get to find out what they're doing, what's working for them, what's not working for them, asking questions, and then also gaining valuable tools. I will say that Lisa and Dawn are bringing a lot of great tools for us to build this program in Washington State and hopefully move it off of a waiver into a permanent position on the Medicaid plan.
Thank you, Mindy. I will tell you, I went to the cash and benefits planning training, and it was exceptional. The gentleman that had done it has been a certified benefits planner for quite some time. And I know that's been one of the things that people bring up on a regular basis is how hard it is to get benefits planning training. It's good basic training. You're not going to be a benefits planner by the time you're done, but it is free and it's of high quality. So if people want to know more about that, send me an email. and I will get the information to you. I see some other questions. Sandra says, how do you prevent burning bridges with employers due to unsuccessful placements?
You know, that we haven't burnt any bridges yet. We have found a couple places that probably are not a good environment for our clientele. Some cases, maybe not a good environment for anybody, but we, knock on wood.
That happens.
It does, but knock on wood, we have not burnt any bridges as of yet. And I have to say that goes towards my staff more than it does to me. My staff is the ones that are working those relationships, keeping those relationships going. They work very hard to make sure that they follow through with anything that they say they're going to do. They do check-ins with the employers all the time. You know, a lot of employer check-in stuff that we do through this program, it is a lot of it that it's above and beyond even just clients, so it's not billable, but it's worth it in the end, because as long as I can keep those relationships going, then we have opportunities for our clients. So that is something that you kind of have to keep in mind, that there is some work that you're doing that's not billable, but it is going to be worth it in the end.
Very good point. Janine asked, is supported employment and supported education one contract?
No.
Well,
I've never heard of supported education.
The supported education is a piece of supported employment, in truth. It is something, there's actually some new materials on the ipsworks.org website. There's actually also a new kind of a subset of the Fidelity scale that in regards to working with youth, and they touch on supported education. And Janine, if you'd like, I don't know if you got to hear the presentation last month, I think it was last month, from Jonathan Beard when he talked about first episode psychosis and supported education. I can send that stuff to you if you'd like. But it's a subset of supported employment. Leanne says, do you work with DSHS Home and Community Services?
Yes, we do. Cascade has a department called ECS, Expanding Community Services, that works with DSHS a lot. And we have had a couple of those clients too. One of them was the one that I shared with you, the story about that he had some dementia stuff going on. And I will tell you that ECS department was awesome working with us and figuring out how we could best support this client. It did not end in employment. However, there was some small strides. We were able to get the client showering more, dressing more. We did get him out to a couple interviews. But yeah, it just didn't end it. But we do work with them, and at this point with zero exclusion, we will not turn away any referral. The only way that we will even turn away a client is if they just don't have the funding for the services, because the clients will have the money to pay for the services.
Okay. And then Sandra says she went to the cash and benefits training in Kelso yesterday and it was great. Learned so much. Yeah, it was truly marvelous. And Luann said, yes, can you send the information from Jonathan Beard? So as long as it's okay with folks and you can ignore it, if you don't want to read it, I'll go ahead and just send it out with my kind of follow-up email on this, and I'll send you the Jonathan Beard stuff about supported education.
That'd be great.
All right. We are caught up on questions again, so if folks have questions that they want to type in or raise their hand or things along that line, please do. Kind of scrolling through the list to see if there's anybody that I've missed. And it looks like we are in fact caught up for the moment.
Great.
I think it's the age range of people that are on folks' caseloads, Mindy.
I'm sorry?
What do you think is the age range of people that are on your staff's caseloads?
So we've had from 16 to 70.
Oh, wow.
Yeah, we've had the multiple, because we also work with our WISE team, the wraparound services for youth. We've had quite a few referrals from them. I had a young gentleman who I had in my anger management program, and I referred him over. He worked with that for a while, and then he moved away, so then we closed him out from that. But yeah, we've had quite a few of the younger generation, and most of our people are probably 30 to 50, but yeah, we've treated from 16 to 70.
Mm-hmm. How does your community do with working with teenagers? Are you finding any jobs for them? And what tips do you have maybe related to that?
So again, with the lack of resources, our kids, we can work with our kids. We've worked with different things with doing with them. Unfortunately, we have a lot of fast food places, and so those are typically what will hire the kids.
Mm-hmm.
But we do talk to them about what is their career goal. So once we know what their career goal is, yes, they may get the job, but we're also talking to them about that education and helping them apply for financial aid, getting together with the school, or if they're still in high school, like helping them go back and talk with your counselor to make sure that you're on the right track for whatever career you want to do. Or Whitney's really good at researching and finding out what they need to do for the career that they want. So it's just, unfortunately, we have a lot of fast food places here that are the ones that are hiring the kids. We do have a few of the outlet places that will hire some of the kids. And a lot of it is because they need a job that works with their schooling, because we do want to encourage them to continue with their schooling.
Absolutely. And actually, those are good examples of supported education. So those
Yeah.
Yeah, wonderful stuff. I think it's just terminology that not everybody uses. I think some do, some don't, and so that's why it's a little confusing. I see we have some new questions. Are there any partnerships that would enhance your program? Stephanie asked that one.
Yeah, the partnerships that we're really working on and trying to be close with is like DSHS, the TANF Workforce program. We go to the best meetings with them. We also work very closely with Worksource. We go to their monthly meetings. We do try to work with DVR. I was excited when I did my peer review in Puyallup. DVR and Multicare work very closely together. I just don't think we're there yet. We're going to get there. I just don't think we're there yet with DVR. But those are all three of those can actually really enhance, because people think that we do duplicate services, but we're not doing duplicate services. There are things that we're doing that like the TANF workers can't do, but there's resources that the TANF workers have that we don't have access to. So we also are our next steps are to start reaching out to some of the thrift shops and talking to them about maybe we can send a client in with a voucher for one interview outfit if they're in the program, seeing if there's anybody here who would go into a collaboration with us on that. We do have some faith-based programs around here that we do refer people to if they need some extra help with stuff. I know that there's, like, for instance, there's the Gather Church that we make some referrals to if we need some additional help on things that we don't have dollars to pay for. So I would highly suggest that any of those things you guys make connections with, especially the DSHS, Worksource, and DVR. Really make some connections with those, because the people who are on Work First, they only have those 5 years, and sometimes we can help speed it up, or if they're at the end of that 5 years and they still aren't going there, we can wrap even more intensive services around them between the Work First case manager, our program, and really come out with a success.
Great partnerships. Olivia asked, do you find that there is a point in one's recovery that lends itself to being more successful with partaking in the program and maintaining employment?
I think the point in their recovery, to be honest with you, is really when they understand that they can achieve what they want in recovery. Everybody's recovery is going to look different. Everybody has a different path. Any mental health provider, substance use provider, or supported employment provider, you are actually invited on that client's path. And so once that client realizes that they can turn the corner, that's when you really start seeing them make it. I would not say it's, oh, they've been clean for 30 days or they've been clean for 60 days or anything like that. I wouldn't put it on that. It's really when the client realizes that they can succeed. Right. And that's really our job, is just to walk beside them because they invited us. So we got to figure out what's going to work for them, for their life, not what I think works for me, for my life.
I know, Mindy, when I worked in the mental health agency that I worked for 21 years, one of the things we found too is lots of times we help people find jobs when they were actively using, and maybe they lost a job because of it, or maybe there was drug testing done and they got excluded because they were using. We saw people become abstinent, become clean because of working. And
correct.
And, you and I had that conversation about zero exclusion and how powerful it is. And, I found over the years that I've been wrong any number of times about thinking about a person and who might succeed because of where they were in their recovery, and just being wrong in both directions. Either I thought a person was pretty well put together and was going to succeed, or that they were so very far from recovery and maybe they wouldn't. Only the person knows if they're going to succeed, and sometimes they don't either, but they know at least to try, and they want to have that opportunity to make that attempt.
And I would say that if you're going to incorporate substance use into your supported employment, make sure that your supported employment staff are not afraid to have those conversations with them, because it's not going to work. Yeah. So we have a gentleman right now who's continuing to use marijuana. However, some of the jobs that they want, they do drug testing, so probably won't. He is not necessarily a client who's in substance use treatment, but the supported employment, they're not afraid to have those conversations with them. And you don't have to be judgmental. Right. It's just stating the facts to them and letting them know, hey, this could be a hindrance. Mm-hmm. He went for one job interview, and it's a part-time job, but he got the job. He still tested positive, but, so you're right, Mary. I mean, some of the things that we're telling them, that you can't have drugs in your system because you can't get a job, well, we kind of found that wasn't true. Yeah. He was able to get this part-time job, so.
Yay.
Yeah, and that becomes on the employer. The employer is the one that made the decision to still hire this client, knowing what they know. So we're just going to support it the best that we can.
Janine asks, how do you integrate Worksource into your employment services model?
So how we've integrated it so far is we do go to the monthly meetings. We do take clients over there to utilize their system, looking up jobs if need be. Worksource, I just started working with PAC, Mountain, and then Worksource I think we had a meeting in May that we're looking at how can we increase those services. So right now it's kind of a surface level integration, but we all recognize the need to make it even deeper. So in our area, at least, we're working on how is that going to look and how does this work.
Olivia, who had asked the question about the point in recovery that lends itself to being more successful, had said, well said, thank you.
Oh, you're welcome.
We're open. We're caught up with questions for the moment, so we're open for more. Like I said, you guys are doing a really great job this morning of asking questions, so please feel free to ask. Here I see another one. What does the relationship with DVR look like, being you cannot provide services for the same client simultaneously?
So again, we're not providing the same services, so we can provide services simultaneously. So basically if we have one, we haven't had one come from them yet. If we had one together, we would work it just like what we're working with the other teams. We would have meetings with them. We would be talking together back and forth of what's going on. But DVR can't go sit at the employer and watch the employee work and give that kind of feedback. DVR can't do that. So those are that's just one example of something outside of what DVR can do that we can do. DVR can help with buying stuff for the employment that we can't do because, again, I don't have the funding to do that. I know that there was some grants that went out. Unfortunately, I was behind the 8 ball on that grant. But we do different services than what DVR does. So, because remember, our supported employment, that's exactly what we are, is we're supported employment. It's not necessarily at least I don't believe that the end goal is actually getting them a job. Our end goal is supporting that employment, whatever it looks like. So that's why we get to have the post-employment.
And I'm going to speak to that from a little different standpoint. I worked for an agency that was a community rehab program. So in other words, we were a DVR vendor. And what we did in order to make certain that we were not double dipping, because you can't. Both Medicaid and DVR say they need to be the payer of last resort. So within our system, we had assignments. So an individual would be assigned to a clinician or to a supported employment specialist based on the service they were going to receive. So in our system, we would have a supported employment assignment. We would end that, make it a DVR assignment, which means all the services only went to DVR for billing, because as a CRP we had that, they had referred back to us to provide the service. And then we ended that assignment and started the supported employment assignment again for that long-term support, which DVR doesn't provide. I would say for agencies that aren't a community rehab program, you do have to be a little careful about, if the DVR counselor, and some of them do, the ones in our town did, talk to employers on a person's behalf, and you're also going out and talking to employers on a person's behalf, that is a duplication of services. So Mindy said collaborate. Absolutely collaborate. Make sure that you're not doing the same things. Be very clear about what you're doing. And her point is really good as well. DVR doesn't provide support related to a person's mental health or substance use issue. When I would go in and do job coaching with people, it would be related potentially to, okay, you're feeling anxious now. How do you manage that? What are you going to do in order to decrease your anxiety level? Well, that's not something that a DVR counselor is going to be able to do. It's very specialized, and the reason why we provide services. So just collaborate well, be very clear on who's doing what, make sure that there's never billing for the same thing at the same time, and ask questions, certainly, if you have them. Feel free to call Lisa Bennett-Perry or to call me, and we can work through cases. We do that on a fairly regular basis. Call AmeriGroup, make sure that they're on board with the way you're doing it. And the communication is key.
Yeah, and one of the things too, that what we've gotten with DVR is we're on their wait list. So if they've got people that can't get into DVR because of the wait list that's going on there, they do have us as a referral and making us the referral source for them.
Oh, great point.
So that's the other thing that becomes really important, is at least going and talking to them and having those conversations, because then they know that you're a resource. If you never go and have the conversation, they don't even know that you're a resource.
Very, very good point. Looks like we're caught up on questions again, but I have no doubt there'll be another momentarily, because everybody's been so great about doing that.
Yeah, this is great, guys, because that way I know exactly what you guys are interested in. But like I said, the biggest thing when it comes down to whether they have mental health or substance use, we just have to remember that their recovery is their recovery, and we can't force them to do anything. We can walk beside them and give them and don't get frustrated with them. Don't have an expectation that they're going to do A, B, and C, because they may do D, E, F, G before they do A, B, C. But that's okay. That's where they're at in their recovery, and that's what we're going to do with them.
I had a person on my caseload years ago that said, so it's like I'm the driver and you're the GPS. I said, that's actually perfect, because you can choose which route you want to take on your GPS. It's for advice only and support and to help you get there, but it doesn't make you get there. You do. So I loved her analogy. I thought it made perfect sense.
Right.
Any other questions? Like I say, we're kind of caught up for the moment.
So, and going back to the supported employment staff, I'm just thinking that question over in my mind again. And yeah, I think creativity is one of the bigger, outside of having computer skills, which, they have to have, because they have to be able to help clients navigate building resumes, searching the internet, that kind of stuff. But thinking about that question, I really do think creativity is the biggest thing, because you don't know how you're going to get somebody a job. Because supported employment, in my mind, is not your traditional, oh, let's go down here and put in how many resumes and now you're going to have a job. That's not supported employment. You have to be creative. You have to sit and talk with the clients to find out what their strengths are, what their weaknesses are, and be able to kind of read between that. They're going to come in and try to impress you in the beginning, because they want that job and they think you're going to get them the job till you start explaining them that, no, we're going to do this together and that kind of stuff. But as long as you're thinking outside the box and creative, I think you're going to be successful. And if you didn't do it the first time or the 10th time, you just got to keep working with it. Like Mary said, we're at an advantage. We get to have them for long term. We get to, you get a 6-month authorization. Yes, we want rapid job search, and you should have rapid job search. That doesn't mean that they have that job. That means that we're searching for the job with them and doing that. So if it doesn't happen, you still get to work with them. Right. Keep working with them.
Well, and I think that's one of the benefits of IPS that I did supported employment for a lot of years, that I help people find jobs. With IPS, we help them find more. But I think one of the hallmarks of IPS is the fact that if the first job doesn't work out, you help them get a second and a third and a fourth and whatever it needs, whatever it takes for the first person to end up in a job match that's a good one. I was talking to a group yesterday where we were at the TANF conference, Worksource in Wenatchee, and I asked the folks in the room, are any of you still in the first job that you ever got? I don't know of anybody that's in the first job that they ever got. And so our expectation that we're going to place a person and they're going to stay there forever is really unrealistic. So I like the fact that IPS allows for, and in fact encourages, learning from what went well and what didn't, going on to the next job and making a better match, and hopefully getting to the point where it's a really good match. So
yeah, that's really what it is. I mean, and I think that's the key to having the post-employment, because yeah, we can help get them the employment. That, I think for me, that was really the buy-off, was the post-employment thing, because I knew integrating it into Ssdi, there was a high likelihood that the first job that we helped place them in was not going to necessarily be a good placement or work out or whatever. So being able to keep them on the books in a supported employment or post-employment role, knew that we had the opportunity to kind of go back around if need be. There's some of them we haven't had to do that with, but if we needed to, we had that opportunity. And you didn't have to go through all the paperwork, and you didn't have to reassess, and you didn't have to get a new authorization, and you didn't, you know what I mean? In the healthcare, we have to do a lot of that, and with this, we didn't have to do that.
Yeah, thank goodness.
Yeah.
All right, looks like we've slowed down a little bit on questions because we haven't had one for a couple of minutes. Do please, if you have a question, raise your hand, or type in the chat box. Mindy, I've got to ask, what's kept you in the job for as long as you've been in the job? What do you like about what you're doing?
Well, I really, really enjoy our clients. I've learned that these are some of the most amazing people that I've ever worked with. The survival that they've had to do, how they learn how to work through their trauma. Well, granted, a lot of it was maybe negative coping skills, but to watch them change all of that and become positive coping skills and just the joy in their face, it's just amazing.
Yeah.
And I've been very lucky to work with, coworkers. I've had great coworkers. Being in a director position now, I have great employees. I'm gonna go so far as to say I have the best employees.
Yay.
I do. I have a great team. I like diversity because that helps with our clientele. If we didn't have, we can't have everybody treating everybody the same way because nobody's the same.
Mm-hmm.
But yeah, I really think that's what it is. It's just, you would be amazed at this clientele. If you give this clientele a chance, they will surprise you. Yeah. Sometimes they will surprise you in a negative way, but most of the time, they do in a good way. And my philosophy, and this is another reason why I like supported employment, is my philosophy is I don't care how many times you walk through the door. Walk through the door. If you need our help, walk through the door. There will be absolutely no judgment. And my staff know that. My staff know never judge a client. Mm-hmm. I never want to hear you talk to a client in a judgmental way. I never want you to show body language in a judgmental way because we've all had to reach out for help.
Yep.
And maybe some have to do it more than others, but we've all been there. Every one of us on this phone call have had to ask somebody for some sort of help.
Yeah. Well, it sounds like, just based on what you're saying in regards to successes in your program, that your staff does a good job of being non-judgmental and accepting and welcoming. And I think all of those things are huge. And I would agree with you. The people that we serve are amazing. And I've learned so much over the years from them and continue to learn. So it's something that I appreciate as well. I do see we've got a new question. Janine asked, do you have part-time people, and are they supportive people, or are they required to do all the tasks required on the Fidelity model?
So they are required to do, all of my staff are full-time. I am the supported employment supervisor, so I've been through the IPS supervisor role. But yeah, they do pretty much all of it. It's what we find that works for us. I guess that's the best way that I can answer that. That's what we find works for us. Like I said, all the peer reviews are starting to come out, which if any of you are scheduled for a peer review, have that come to you with open arms. You can learn so much from it. I just did a peer review in Puyallup at an agency, and it was amazing to see what they're doing. And my peer review is going to be in September, and I can't wait for them to come down and get feedback from them, because as towards your question, I'm sure there's things I can change up here. While I feel that we're being successful, I'm sure there's things we can change up.
And so Janine says, so you don't have any part-time people, correct?
No, not at this time.
Okay.
And that's the other thing is our staff they don't have to be like 9 to 5. I have one staff member who works 4/10s. I have one staff member who works 5/8s. My new gentleman who just started this week, I'm going to be working with him later this afternoon to figure out what kind of schedule he wants to do. But even though that's their basic schedule, they flex as needed. Like we have the Chamber of Commerce, every month there's a Chamber of Commerce like meet and greet at a different business. So the girls will say, hey, I'm going to flex my hours and go to this one day. And I'm like, great. Now, granted, that's not necessarily something that I can bill for. But again, this is them keeping those employer relationships going, and they're out in the community. They're getting known out in the community, so they have a good reputation. And the biggest thing is make sure you do what you say you're going to do. Don't just go in there and say you're going to do something for an employer, and then you never show up again, because you will ruin any relationship that you have going.
Very, very good point. You know, and I would say too, you're right about the meet and greets. The staff that I supervised used to go to, or when I was there, they went to the Chamber of Commerce after hours. One thing they did do is if they met up with an employer and had a conversation with a specific person in mind, and they did that progress note, then they could bill that little piece. But you still got to do that stuff. You got to get your face out there. You got to talk to employers. I've always said it's tough to help people get jobs if you never talk to employers. So
exactly, and that was a good point, and I'm glad that you brought that up, Mary, because yes, if it is specific to a client, then we can bill it. But a lot of times at after hours, you just never know who's going to show up. So
yeah. Well, and if you're working with people in the job that they want to do when you're providing services, sometimes job coaching happens on weekends or graveyard, or I've done some of each of those, and you know, it's what's helping the person to succeed is the basis for what you do. Here I see another question. Jesse says, what do we do when a client continues to not show for interviews that have been set up?
Well, we've had that situation a lot. We just keep working with the client. We keep a lot of that. That's where I had the girls start doing the motivational interviewing to kind of help them working with the client and asking the client to give us feedback. So how does this look to you that it will work if you're getting interviews set up and then they don't show? And then kind of drilling down a little bit is a deeper issue. A lot of them that weren't showing up to the interviews that were scheduled, in the end, yes, while they wanted to have a job, they were still just a little too fearful to make that jump. Mm-hmm. So there is kind of a fine line. I do believe in once a client says, I want to get a job, that they're a good referral. But sometimes as you start working with them, they're not really a good referral, because while they want to do that, they don't have the confidence in themselves. But there's no harm in doing that first 6 months of the authorization with them. There's absolutely no harm, because like I said previously, at least they're getting a taste of what it takes to do this. And they do build skill, believe it or not, even not showing up to that, but to an interview, but they show up to your appointment, they are still developing skills there. So you can continue to help them with skills for their employment.
Absolutely right. Olivia says, can you talk more about your relationships with TANF and Worksource? Specifically, what services they can provide the clients that we can't? And Jesse said, thanks.
So I do want to apologize if I do get this wrong, if there's any TANF people on there, because this is going from what I understand the program to be. So I've worked with the TANF program for a very long time. Back in the day, I don't know if there's any chemical dependency people on here. We used to have Ssdi people stationed in the DSHS office doing TANF assessments and a DSH assessment. So I have a good relationship here in Lewis County. But my understanding of TANF Work First is the case manager pretty much outlines a plan for the client to come off of TANF. They set some goals for the client to do, but as far as helping the client accomplish those goals, that's not really something that the TANF worker can do. That's not really in their job scope. So if their plan is that they're supposed to do 5 job searches in that week, that's not necessarily the TANF caseworker who's going to sit there and help them do those 5 job searches. Supported Employment is going to help them do those 5 job searches. And they're also going to potentially help them go drive them to an interview. A TANF caseworker is not going to drive them to an interview, if that makes sense. So that's the difference there. So while the TANF caseworker, to get them moved through the process and get them off of Work First, they have treatment plans put in place, which I know you guys don't call them treatment plans, but we actually can help that case manager help the client achieve the goals and interventions that that they have on that treatment plan, if that makes sense.
It does make sense. And I think one thing I would add to that is we can actually help the DSH worker with their the person's participation hours. I know when we worked with folks and they had their plan, if we maintain close communication with the worker, they'd ask how many hours we put in a week with the person. And they counted that towards what the person on TANF had to do in order to comply with what they were expected to do. The second half of that question was Worksource, and specifically what services they can provide the clients that we can't.
So Worksource, that here helps them like get on unemployment. They have a whole bank of computers sitting there that's available to them. Worksource has a running list of job openings that are there. I honestly don't know all the services that Worksource can do. There's a lot that Worksource can do. But again, what's different from all of those programs that I find is the biggest difference between Supported Employment and any of the other work programs is Supported Employment is the person that can make that phone call to them in the morning to make sure that they woke up in the morning to get to work on time. Make the phone call to them after work to say, how did it go? Did you have any problems? We can take them to the interview. We can pick them up from their job. You know, there's things that we're able to do to support employment. I guess that's the key. We support their employment in whatever it takes. Worksource and the other things, their employment, like get it employed. I know that's simplifying it, but that's in my mind how I look at it. Do you see that that's different, Dawn?
Most decidedly. Yeah, no, I like the way that you explain it very, very well. I think one thing I would add to that is Worksource is a conglomeration of agencies, and
yes.
DBHR being one of them, Employment Security being one, the Workforce Development Councils being another. Like in Moses Lake, they're called Skill Source. And I know there were people on folks' caseloads that worked with the employment specialist and then with Skill Source. Maybe Skill Source would fund an OJT, an on-the-job training, or they had other pots of money where they would actually pay an employer a person's wages for a short period of time. So it was an incentive to hire the person and give them a try that we didn't have available when they did. So, you know, sometimes you can go to Worksource and attend their orientation and hear about all the different things that they can provide if you're not familiar. I know that's one thing that they encouraged our staff to do was to attend the Worksource orientation and hear about the different services. But there are a variety of things there that can help. The Skill Source and the on-the-job training thing was one of the biggies that we accessed. Let's see. Jesse says, how has working with Dvr been for you?
It's been fine. Like I said, we have more of a surface level relationship with them. And I say that, and I don't mean anything bad by it. I just mean that we haven't got as deep as a relationship with them as I would like to see us get. But they do, like I said, they have us on their list of referrals for their waitlist clients. So I think that where we're at a really good place with them, and I think that they're open to it. Unfortunately, like any agency, they're extremely busy. So trying to schedule out meetings for all these different types of services and trying to get them to come to the table, it is a little bit of work. And I appreciate anytime any of these different agencies want to come to the table with us and work with us. So, but yeah, as far as our DVR relationship, I'm pleased with it for where we're at right now. You know, we're never going to give up, keep working on it, and we're just going to keep plowing through it. So I did want to bring up one other thing then, is one thing that I do have is I have a Suboxone program, a medication-assisted treatment services in my substance use program too. So I have a provider who comes in every Thursday to meet with those clients, and that providers are a big deal in this process, whether you're in mental health or substance use, because if there's issues with their medication or their Suboxone is too high and they're nodding out and those kind of things, those are things that the staff can go talk to those providers and maybe tell them what they're seeing, and there may be a medication change or something like that. So it's a huge thing. Now, we don't do the medical side of it. That's not our role. But it is our role to provide feedback to those providers once we receive it. So, you know, we wouldn't be taking them to the provider meeting necessarily, because we would hand that over to the mental health case manager and let that, because they'd be part of this conversation also. So, but please know that that is something that you guys need to give feedback on, because the client's going to tell you, I can't stay awake because I'm over medicated.
Great point. I see one other question. It says, if a client has been on SSI for several years, do you still help?
Yes, we do. And that's where that cash and benefits training came in hand. Like Dawn said, we are not experts on this. We know it's a basic 101, but it gives us an understanding. We have taken some clients over to the Social Security office and met with them and to discuss whether or not having employment would be beneficial to them or not. We have had a couple people that had some major medical issues coming up, that they were going to actually have some surgeries, that in the end, it probably didn't make sense right today for them to go for a job, because there was a potential that they would lose their funding, and they needed that for the surgeries that were coming up. So yeah, we work with them if they're on SSI, Ssdi, all of that.
So it sounds like you really went the extra mile in order to make sure they were able to make an informed choice about what they were doing.
Yeah, we really do, because to me, again, that's part of supported employment. If us getting that person a job today who in 60 days is having a major medical surgery, that's not supporting them. That's just meeting my quota.
Jesse says, has asking a client about visits to the ER placed a barrier in working with them?
No. Again, this is where the MI, the motivational interviewing, comes in hand, and the IPS model. When you if you go through that, no, it's how you preface stuff to clients. You just let them know, hey, we're trying to find out what any barrier can be, and multiple trips to the ER could be a barrier. Again, it's about how you work with the client, how you build that relationship with them, if you're showing judgment or not to them. And we really have not had a problem with clients opening up. Now, we have had a couple clients who maybe didn't connect with the one supported employment counselor, and we just moved them to the other supported employment counselor, and it was fine. But it had nothing to do with, it's just like any other type of service. Sometimes you connect with your substance use counselor, sometimes you don't. So having a diverse staff helps because they can go to, you can switch them around if you need to.
So Janine asks, if a person is on Ssdi and Medicare, can they use SE services or is it only Medicaid?
It's right now it's only Medicaid. It's through Amerigroup. So it is a Medicaid waiver program.
So this isn't helpful at all, but Janine, one of the things to be aware of is if a person starts working and they're on Ssdi, they can request to switch over to healthcare for workers with disabilities or the Medicaid buy-in program, and then they can receive their long-term support as a Medicaid billable service. So I can't help, but maybe a glimmer of hope. I don't know. Luann says, thank you so much for all you do. I have to do another meeting, so thank you for attending, Luann.
Thank you.
Janine says, okay, interesting. That's, the healthcare for workers with disabilities will come up in that cash and benefits planning training. That's one of the things that Spot discusses. So
that'll be good, because like I said, I'm excited about doing that next week. I actually had to take the one in Everett because I couldn't get to Longview today, but yeah, I'm very excited about that training. But I want to thank all of you guys. I know that I don't do a PowerPoint. I know the questions are, I love the questions. Thank you to all of you who ask questions. And Dawn, if you want to include my email address in the follow-up on this, if you guys have any other questions, please shoot me more questions, and I can always answer to the best of my ability.
Wonderful.
I'm always open to, if you're close by, you can come on down and meet the staff and meet me. We can schedule a time just to kind of have roundtable and talk. I mean, like I said, I believe in this program. I believe that we need to do the best that we can to move it off the waiver and make it part of the state plan. So as a community, I think the more we do together, the more chances we have of that happening.
Amen to that. Thank you so much, Mindy. You did a marvelous job. I really appreciate all your insights and your information. Thank you to everybody that attended. I'll send out. Jesse says, where are you located?
Oh, we're in Chehalis, Washington. And Dawn, I think you can send this out too with my salutation on the email. Our address is 135 West Main Street in Chehalis, Washington. And our phone number is 360-748-4339. And like I said, we can put together a roundtable and have some good discussions on how each other's working. Because I can learn from all of you just as much as you guys hopefully learned a little bit from me today.
Absolutely. Well, and even if we want to do one of our topical employment webinars as just a roundtable to do that kind of thing, or the Job Developers Community of Practice call, I encourage people to attend that because we have the chance to shoot ideas off of each other. So one way or another, it's possible to do it. Thank you so very much, everybody. Have a marvelous day, and hopefully we'll see you next month.
Okay, thank you, everyone.
All righty. Bye-bye.
Bye.